Since 1991, the U.S. cancer death rate has continued to decline, according to the American Cancer Society's (ACS) annual statistics report. While this is excellent news that has saved an estimated 3.8 million American lives, unfortunately, after 2 decades of declines, prostate cancer deaths among U.S. men increased by 3% yearly from 2014 through 2019. Prostate cancer is the second leading cause of death for men in the U.S. The ACS estimates that 288,300 men will be diagnosed with this disease in 2023. This estimate means that almost 20,000 more men will be diagnosed with prostate cancer than the number of men diagnosed with the disease in 2022. Higher rates of advanced prostate cancer drive most of this downturn in prostate cancer rates. This annual statistics report from ACS stated that black men have a 70% higher risk of prostate cancer compared to white men. In addition, black men have a 2- to 4-fold increase in deaths from the disease, a higher rate than any other ethnic group in the U.S. ACS officials stated this is likely from confusion and continued debate over screening guidelines. There are 2 tests commonly used to screen for prostate cancer. 1. Prostate-specific antigen test or PSA blood test. 2. Digital rectal examine or DRE test. Both the PSA and DRE tests can be done at a doctor's office, and both help screen for possible prostate cancer at an early stage. Finding prostate cancer at its earliest, most treatable stage can result in a 98 to 99% survival rate. Conversely, prostate cancer that has metastasized or spread beyond the prostate gland or is at a more advanced stage makes treatment more complex, with survival rates lower. The PSA blood test can detect the amount of protein made by the prostate. Men with a high level of PSA in their blood may indicate prostate cancer but is not definitive proof, as other factors can increase PSA levels, such as an enlarged prostate or prostatitis. During a DRE exam, a doctor inserts a gloved finger into the rectum to feel for any lumps or bumps on the prostate gland. If anything unusual is found on the PSA or DRE tests, further testing may be required for an accurate diagnosis of prostate cancer. The PSA and DRE can be done at a doctor's office and both help detect prostate cancer at an early stage before it has metastasized or spread beyond the prostate gland, making treatment more difficult. As a urologist-oncologist with over 20 years of experience treating and taking care of men with prostate cancer, I recommend beginning at age 40 for men to have a baseline PSA test. Men with an abnormal finding from a PSA or DRE exam would benefit from a diagnostic technique called magnetic resonance imaging, MRI, fusion biopsy. MRI fusion biopsy provides a more accurate diagnosis for determination of prostate cancer. This tool has dramatically changed how we diagnose prostate cancer and whether to go ahead and biopsy. The other factor that needs to be addressed is reversing the differences between black men versus white men and prostate cancer diagnoses and death rates. The ACS has a plan called Improving Mortality from Prostate Cancer Together, Impact, to reduce death rates among black men by 2023. This plan includes improving education, new research programs, and a second look at prostate cancer screening guidelines. With new diagnostic tools and efforts to reduce prostate cancer rates and mortality, the future of fighting this disease among men looks more promising.